what is Ayurveda? If somebody wants to follow Ayurveda, is it important then to just be vegetarian?
Ayurveda doesn't tell you to be vegetarian. It's your personal choice. It looks like food, but it's not food. So, packaged food, processed food, eating without appetite or not eating or not listening to your body calls is something, the biggest insult to your bodies you can do. Please stop doing that. For simple problems, Shweta, sometimes we don't even require herbs. Just time heals them. And with guidance of do's and don'ts, we tell the patient, okay, don't eat this or that for some time. And they are good. Within 1 month, they are fine. People are running like machineries these days. Running around, doing, sometimes not aware of what they are doing.
Namaste and welcome to Healing Through Ayurveda, a space where ancient wisdom meets modern living. Hi, I'm your host Shweta Bajaj. Though I come from the world of IT and hold a master's degree in physics, I've always been drawn to ancient wisdom and science of Ayurveda, yoga and spirituality. Through this podcast series, we will explore how this ancient wisdom and science of Ayurveda can help us live more balanced, conscious and healthy lives. Joining us on this journey is Dr. Gaytri Kalia, a renowned Ayurvedic physician with an MD and PhD in Ayurveda and over 25 years of clinical experience. She is also the founder and chief Ayurvedic consultant at Gayatri Ayurveda. In today's episode, we will explore foundational questions that are essential to understanding Ayurveda. So whether you are looking to start your journey or deepen your understanding in Ayurveda, this episode is for you. Hello, Dr. Gayatri. Welcome to the show. Really good to have you.
Thank you, Shweta. Thank you for having me here.
Thank you, doctor. So today we will start with the basics of Ayurveda. For our audience, I would like to ask, what is Ayurveda and why is it important in today's world?
Yes, so Ayurveda is derived from two words, Ayu and Ved. Ayu means life and Ved means knowledge. So systematic knowledge or science about life is Ayurveda, which tells you about all the dimensions of life, which include the physical body, the sensorial body, the mind, and the soul, which is the Atma. So it's a combination, it's a bridge between these four entities, which Ayurveda teaches how to take care of it, how to look after it, how to maintain the normalcy of life, how to have a healthy life, a graceful aging. That's what Ayurveda is meant for.
And why is it important? How can we live healthily if we follow Ayurveda?
Since Ayurveda talks about the fundamental aspects of life, it teaches you right from the beginning that what are you? What type are you? What is your body type? What can you do to remain healthy? What should you not do to remain healthy? What you should be eating, what you should not be eating, what practices you should be indulging in, what daily routine you can practice, what you should not be practice, what is the routine according to the seasons, does it change or not, or to what extent a person needs to change that routine, and what foods are absolutely no for people and why. This is all taught by Ayurveda. And it's not just limited to food. There is one more step. We have herbs, which are so powerful, very potent to correct the dosha imbalance. And then they bring the normalcy back to the individual. They help people to get rid of illnesses. Like the nature provides all the solutions to all problems. Ayurveda just provides the way how to use this nature and these remedies to balance yourself. Plus, there is one more aspect, that's the detoxification aspect, which talks about through panchakarma, how you can get back to the normal level. Even if you are intoxicated or polluted, your kidneys are shut down or your liver is not working or your basic organs are not answering the way they should. And then how then Ayurveda can come into action and help detox your body, clean your body so that it resets. You know, when your computer gets stuck and there is some virus in the computer, what you do? You restart it and give it some time to rest and it comes back to normal. Same is the case is our bodies. Our bodies, when they are diseased or when they are stuck at some point, they want a break. They want to reset themselves. there's this fundamental principle is called homeostasis. Body wants to go back to its normal stage to heal itself. Ayurveda just provides the right answers how it can do that, whether just by yourself or with the help of a Vaidya or with remedies, herbs, or detoxification.
Right.
That's why in this present era, it's even more relevant, more necessary.
So basically, Ayurveda teaches us how to stay in harmony with nature, and our bodies have the capability to heal themselves.
Yes.
But Ayurveda just guides us in the right direction and how to
Yes.
do that.
Once you have a consultation with a good Ayurveda Vaidya, he or she will be able to tell you your body type and tell you, okay, this is a good thing for you, this is not, and these problems are usually, affecting you more, or you have to be careful about this problem or that problem. Let's say if you are a Vata person and you are coming at an early age, 20 or 25, you don't have any proper disease till then, you are healthy and you want to remain healthy, and you're coming to an Ayurvedic Vaidya, what can I do to remain healthy? I am Vata. Now I know I'm Vata type, then what can I do further? Ayurveda has the answers to tell you, the Vaidya will tell you that yes, even if you are a Vata Prakriti person, you are healthy right now, but you are susceptible to certain illnesses, such as insomnia, such as anxiety, such as joint disorders, dryness of joints, or weakness of limbs, or backache. So if similarly, if a Pitta person is coming to us who's absolutely healthy, he's susceptible to problems like high blood pressure or skin issues like eczema or itching or hives or rashes, or even, psoriasis or complicated diseases like that.
Right. So these diseases basically arise when there is a disharmony or imbalance of the doshas.
Very
now we
correct.
hear about all of these doshas all the time, like Vata, Pitta, Kapha that you mentioned. So we, what I understand is all human beings, living or non-living things also, they are comprised of all of three doshas.
Yes.
And any disharmony in one of them can lead to disease. So for example, you said a Vata imbalance can lead to insomnia or constipation, and a Pitta disorder can lead to
skin problems, hives, rashes.
Exactly. Yes. And Ayurveda basically guides us how to keep those in balance.
Yeah. So Ayurveda will teach you how to recognize
when
these doshas are going out of balance.
So
what is normal, what is abnormal.
So how can I tell about what is my constituency, or what are the doshas?
What is your constitution or Prakriti? Okay. So Prakriti is all about normalcy, as I said, Shweta. So it's about, how you behave or think or how you respond when you have no disease, and how your gut responds, like what's your usual bowel movement, what's your skin type, what's your hair quality, how you respond to different situations. Like even if a situation in a house, for example, if there is any theft or a robbery, a Vata person would be confused, will be full of fear, afraid, and would escape from the situation. Whereas a Pitta person would try to face the thieves, or, will take a hammer or like a knife and try to face and, face the situation, would not run away. Whereas a Kapha person would be again sitting in one corner, would remain dormant, but would think of some plan of action like calling a police, or with a more settled mind that what can I do, not being involved directly or confronting the person. So this is how your response matters. This is judged or examined also by a Vaidya. This also decides your Prakriti. And this is like one basic thing. This is just an example I'm giving you. This even applies to the patients. Like when patients come to us, we see that a Vata person would be having 10 files, very confused state of mind, would be going to 10 doctors and not following any one of them. A Pitta person would be having a pen and paper, would be taking notes, would be very organized, would be saying, yes, I want to know, I want to fix myself. Just tell me what not to do, what to do. And I want a timeline. He'll be very sharp and to the point. And a Kapha person would be subtle, quiet, listening to most of the instructions, would not be interrupting much. and would try to follow, but may sometimes fail out of his laziness or, food habits, which he's like more used to. So this is how we see like the mental temperament as well, which again, the doshas are reflecting in a person or a constitution. So it's not just the external experience, external appearance of a person. Like if a Vata would be there, he would be probably lean, thin, dry skin, dry hair, slim. Pitta person would be a moderate build, would be more glowy, or would be having some acne, or very bright and sharp and witty. And a Kapha person would be a little bit obese or overweight, or kind of a chubby guy or girl, and again with a fairer complexion of skin, and slow in understanding and in speech as well.
Yeah.
So it reflects in everything, not just appearance, your thought process. And then when it comes to the gut health, again, it implies over there as well. A Vata person would usually be constipated,
Right.
or would have dry stools, or would need extra effort to go to the washroom. Whereas a Pitta person would be very quick, fast, probably would have easy diarrhea, or would have 2 to 3 motions per day. And a Kapha person would actually have one motion, but may be slow and may take time in the toilet to.
Right.
So these are simple things. These are some examples I can quote here, but there are so many other parameters. We ask questions about normalcy, and we ask questions about the history and relation to the doshas.
Right.
We connect everything with doshas.
Right.
Normalcy, abnormalcy, behavior, pattern, regularity, irregularity, how he's speaking, how he's behaving, is he going to follow or not? Everything is governed by the doshas. So that's such a beautiful world of doshas, which teaches us so many things and makes it so interesting. Bringing back to balance and to normalcy is Ayurveda.
Yeah. So what I'm hearing is the doshas does not just tell you about your health, they also tell you about your personality.
Yes, a
Right.
lot, big time.
Right.
Yes.
So it sounds like you can assess a little bit about your doshas based on the characteristics that you mentioned, but you definitely need to go to a Vaidya to do like a deeper assessment.
Yeah, it's always a good idea to go to a qualified Vaidya who knows the principles of Ayurveda, who has experience, who has qualification, and who loves Ayurveda. And then you will be guided in a better way. Of course, it's not just about home remedies, Shweta.
Yeah.
It's not just about watching few videos and following, okay, let me use haldi or cinnamon to get down my sugar levels. No, it's much more than that.
It's much more detailed than that.
Yes.
Right.
And I would also not recommend, sometimes patients come and try these remedies and start using even herbs. Like home remedies is still fine. They are meant for common use and it's a matter of education, right? But when they start using actual herbs and they go out of balance and then they blame Ayurveda, they say, this happened and randomly we were using this. That's not acceptable.
Yeah, so Ayurveda is not something that you can do home treatments. You can do home remedies, but not treatments.
Yes,
right?
Correct. You need guidance.
Right. Doctor, I do want to ask you one question, that in today's world, there's not a lot of faith in Ayurveda. People have more faith in modern medicine, but not so much in Ayurveda. What do you think is the reason?
I think there is a lot of faith. I think people are loving Ayurveda now even more than usual. They are now fed up with the modern system. Even I would say both the systems have their good and bad points, or strengths and weaknesses. That's a better word. If you want quick fixes and you have no time to look at yourself and take care of your bodies, which are gifted by God to take care, then okay, you can go with whatever you want. But if you want permanent solutions and if you want to address the problem through the root cause, then Ayurveda is the answer. And it's also not true that Ayurveda takes time. It is not always true. So it depends, again, to whom you're going and what kind of quality herbs you have been given. That also decides the trust. So for winning the trust, you need efficacy. And for efficacy, we need good quality products. for good quality products, you also should have a background of good manufacturing companies and, altogether, not just knowledge.
Right.
It's the correct application of that knowledge in a good way, which decides results. Plus, if it comes on the patient's part is more important than a Vaidya's part. We have 4 pillars in Ayurveda for a complete recovery of any illness. The Vaidya is important, herb is very important, or any medication. Third important part is the patient himself. Like if we are telling the patient, let's say if you are suffering from sinus issues, I would say, Shweta, please don't eat dairy products for maybe a month. And if you don't listen to me and you're eating an ice cream every day and expecting an Ayurveda herb to work the same way,
that's not going to work.
That's not going to work. So this is how Ayurveda works. We, of course, have to abide by the rules of eating, abide by the rules of choice of eating and fasting, and sometimes eating according to your dosha type, which will be required.
Right. I do want to talk about how does one find a good Ayurvedic doctor or a Vaidya, because it's not just anybody can become or can be qualified as a Vaidya. Like you are a MD and PhD in Ayurveda yourself. So there's proper qualifications, there are proper institutes, right?
Yes.
So maybe one should be looking for
yes,
qualified.
Of course, the degrees do matter. Higher it is better, but it's not always true sometimes. Experience also is very much needed.
Yes.
And there are many qualified doctors all of Ayurveda all over the world now. Of course, basic qualification comes from our home country, India. But there are many institutes and there are Ayurveda practitioners as well who have basic understandings and more an application of Ayurveda as well. And you can just find and check yourself and you'll be glad to follow Ayurveda.
Thank you. Thank you so much.
Yes.
In Ayurveda, doctors usually look at the pulse, and that's how I think the Vaidya would find out what is the dosha or the prakriti or the vikriti in a person. So what do you look when you are checking a pulse?
Nadi pariksha or pulse diagnosis is one criteria. It's not everything. That gives us the basic understanding of the doshas at the normal level. That means the prakriti of the patient and vikriti as well. So when we put our 3 fingers on a patient's wrist like this, then the 3 fingers, the vibration, the energy is felt on these fingers, the palpations. Like this is all about experience. We come to know which dosha is out of balance or in balance. But that's not the only thing. We also have to be very sure about the questions. Basically, the examination starts at the level of observation itself. As soon as the patient enters, his gait, the way he speaks, the way he looks at you, his over body composition, whether he's overweight or not, or he's underweight, the way he sits, is he in a hurry or he's calm and quiet. And further, some questions about his digestive fire, how is his appetite, how is his digestion, how is his sleep, how does he do about his daily habits, what are his food habits, is he taking just a coffee from a store in the morning and not eating anything and just buying a sandwich, or he's eating proper meals. So all the questions are asked in the first consultation. It's a detailed consultation.
Right.
We ask about most of the things. And then, of course, the chief complaints are there. Why has he come over to an Ayurvedic Vaidya? What does he want to fix? And how much he is committed to fix it. So that all decides the choice of herbs, the type of diet recommended, and it has to be customized.
Right.
Every person is different. Shweta.
Yeah.
It has to be customized and one size doesn't fit all.
Oh.
And this is now people are realizing that yes, why one tablet works for one person, but the same tablet does not work for the other person.
Right.
Because the body types are different, the genetic compositions are different. There is an array of the doshas, which is also playing a very important role. Right. So we have to take care of all that as well.
Yeah. Yeah, so it is different than modern science in the sense that modern science only looks at the blood work and the blood test, right?
Yeah.
Which may not be a true reflection of your health, right?
That's
But in Ayurveda, you're looking at more holistically, where you're looking at a person's personality, habits. You're doing another questionnaire, you're doing pulse assessment, and also probably looking at the blood reports.
Of course, we do look at the blood work. We have been trained in modern medicine as well, so we do kind of connect things because they give us an idea. Let's say if your bilirubin is high in your blood work, that will give me a very clear idea that your pitta is high, because it's a byproduct of RBCs, which is also a type of vitiated pitta dosha. Let's say your hemoglobin is less, and that gives me an idea that rakta dhatu is less. So it just gives me a support or an idea, but that's not something which I rely on completely. I would never look at the blood report and give the prescription. I can never do that. An Ayurvedic Vaidya should never do that. We would look at the person, talk to him or her, look at his tongue, pulse, eyes, nails, and if possible, like examination of the abdomen and feet. Everything is done, and the blood work is seen if he or she is carrying with him.
Right. Yeah. So that's why I said it's more holistic. You look at every aspect and then come to a conclusion.
Yes.
So that is the way how Ayurveda basically diagnoses and comes to the root.
Yeah, nowadays, even the modern medicine, fortunately, they are also looking at this angle. This, yes, every person is different, and there should be a customized approach.
Yes.
There are 20 antihypertensive drugs in the market, like even the regular allopathic ones. But now they are choosing, okay, to which type of person, which medicine would suit. Now they are thinking on those lines as well, which Ayurveda has been telling for the last 5,000 years.
Right. So, for example, a patient comes to you, they have high blood pressure. In modern science, or a modern doctor would just give, hey, this is the mg of amlodipine. Maybe you take 5 mg or 10 mg. And this is like a cookie cutter for almost every patient. But how would Ayurveda look at this differently?
According to Ayurveda, high blood pressure is Raktagat Vat. That means Vata dosha is very high in the Rakta Dhatu, and it's circulating with lots of pressure. So we have to pull this Vata down first. And then, of course, because Rakta dosha has primarily Pitta dosha in it, we have to work on the Pitta dosha as well. And if there are signs of, let's say in the blood work, high cholesterol, triglycerides, which are showing that the blood vessels are very tight due to cholesterol deposited in them, then we need to work on the kapha dosha as well. So we have wonderful herbs working for high blood pressure, which don't just treat blood pressure for that day, but actually for taking them for, let's say, 3 months or 6 months and managing the diet accordingly, the person can become completely normotensive. That means the blood pressure problem can be completely
So it
cured.
can be reversed, you're saying.
It can be reversed.
But the modern science says it cannot be.
It can be. It has been. Yeah.
So I guess that is one of the beautiful difference between Ayurveda and modern science or modern medicine. Because what modern medicine, in my opinion, does is it only manages symptoms.
Yes.
But Ayurveda is looking more at a root cause. And eliminating it from the root, and certain things can even be reversed.
Yeah. So let's say there was a patient recently coming to our clinic. All his blood work was normal and no genetic history was there for high blood pressure, young guy. And he said, oh, doctor, my blood pressure is rising these days. I'm very worried, very concerned. A Pitta guy. So I looked at everything and then I asked him, do you snore at night? And he said, yes. And that gave me a very, very clear idea that he's suffering from sleep apnea. He had his, there's an uvula, which is behind the tongue, which is enlarged, and that obstructs your airway. And then you can't breathe in properly. You won't be sleeping well throughout the night. You won't be rested. You won't be completely fine in the morning. You'll be irritated. And then why not your blood pressure will go up.
So it's a response. It's
response to that problem. Right. So we need to hit that problem. So we need to correct sleep apnea.
Right.
We do nasya for that. We also do Shirodhara in according to the situation.
So in this case, you're not just giving blood pressure medication.
No.
You are trying to find what is the root for that.
Yes.
And then trying to correct that so that the blood pressure would automatically get corrected.
In his case, sleep apnea was the cause. And if sleep apnea is cured, his blood pressure would come down.
Beautiful.
This is how Ayurveda approaches. So, yeah, we have to, of course, dig into a lot, like see what could be the possible way.
So you mentioned herbs is one of the treatments in Ayurveda.
Mm-hmm.
What are the other modes of treatments in Ayurveda?
So for simple problems, Shweta, sometimes we don't even require herbs. Just time heals them.
Mm-hmm.
And with guidance of do's and don'ts, we tell the patient, okay, don't eat this or that for some time.
Mm-hmm.
And they are good. Within 1 month, they are fine. So they're back to the normal Prakriti. Herbs is the second step. Or if we want to speed up the treatment, we need herbs because they are more potent than just the food. For example, if you have a flu, I might not give you any medication. I would say, okay, wait, hydrate yourself with some warm teas and use some cinnamon, ginger, tulsi, and just take some steam and take a rest and you'll be fine.
So how do you find that if you have to just give somebody guidance on food or somebody needs herbal treatment?
So it depends on the extent of the ailment. If the problem is more serious, we need intervention of herbs. And also it depends on how quick the recovery is required by the patient.
Mm-hmm.
So if there are people who just want to stick to the diet and want to follow the same until they get the results, they are not in a hurry. So we have such clients as well. And people who want, as the same time as with the diet, they want some herbal intervention, herbs are definitely given to them. And the third modality is panchakarma.
Mm-hmm. This is the term we have heard a lot.
Yes. So that's detoxification or biopurification. It's like resetting by cleansing, internal cleansing of the channels.
Right.
That is required in a condition when the doshas are too much out of balance. And we are kind of doubtful that the herbs may not be enough and diet is not at all enough.
Right.
So we just have certain techniques, very scientific techniques, which are used to cleanse the body.
Can you talk about certain common panchakarma treatments and do you also offer panchakarma?
Yes, we do offer panchakarma at our center. And it's not about common, Shweta. It's a proper scientific modality. So there are 5 different steps or 5 different types of panchakarma techniques. Plus, in addition to that, these are 5 major ways of cleansing. Okay. In addition to that, there are several modalities which are helping this detoxification. Let's say I'm talking about a mental detox.
Mm-hmm.
So somebody who's suffering from anxiety, insomnia, a lot of stress, depression.
Mm-hmm.
In that person, so if there are different modalities again. So the first one would be Abhyanga, that means application of oil and massage, followed by Shirodhara, which is warm oil being poured on the third eye. Nasya, which is oil being instilled into his or her nostrils in a proper way. And of course, detoxification through any of the channels. It could be mouth through the vomiting technique. It could be anus through the diarrheal technique. It could be enemas. Mm-hmm. So, depending on the strength of the patient, residual health of the patient, extent of the doshas, season of the year, and the capacity of the patient to bear the cleansing, we decide the technique of the modality to be adopted.
Right. So these are customizable.
So even there are chances that people are, stuffed with doshas. They are full of doshas. They come and tell us, doctor, we want panchakarma. We want detoxification. And sometimes they are not fit for it. We need to prepare their bodies. So let's say, when you clean a cloth, okay, you are wishing to clean something, a dirty cloth. You can't just rub it randomly and clean it. If it's a very small scar, it will just wipe with water. If it is deep, you need to dip it, soak it in a detergent or shampoo for some time. And then be gentle and kind with the cloth, otherwise you'll tear off the cloth.
Yes. Yes.
Same is it with
Our bodies and
detoxification and
Panchakarma, yes.
Panchakarma. People who are not prepared for it should never undergo it. And it's only a Vaidya who can recognize whether you are ready for it, you can bear it or not. Because cleansing requires prior preparation, then endurance, discipline, as well as pulling of the toxins out of the body, which might make you feel weak for a period of time, but eventually it's a game changer.
Right.
Yes.
I'm just trying to think, what would you recommend to the general audience in terms of, an Ayurvedic tip that they can follow in their day-to-day routine that can help them stay healthy, something that everybody's suffering from, maybe insomnia or constipation. These are things that we see in the modern life day in and day
I
out.
would say, please start listening to your body and mind.
Mhm.
People are running like machineries these days, running around, doing sometimes not aware of what they are doing. So, Ayurveda's first lesson is love yourself, listen to yourself, listen to the calls of yourself. So, suppose you are hungry, you should eat. If you are having a pressure of pee, you should pee. Don't suppress the urges. If you are thirsty, you should drink. If you feel like sneezing, you should sneeze, feel free. People these days are, kind of because of the social pressure or sometimes time constraints, they are not listening to their bodies.
Yes.
They are postponing their hunger.
We are just pushing ourselves,
appetite,
right? Yeah.
even if, or doing the opposite.
Yeah.
Even if they are not hungry, they are eating.
Yeah.
Just because it's the time or whatever is being served into their plate, they are just eating. And sometimes, or most of the time, it's not food. It looks like food, but it's not food, unfortunately. Something which is not cooked fresh, I would not call it food. Something which is not coming from nature, let's say a fruit or a vegetable, something which is not coming like as natural and wholesome, it is not food.
Right.
So packaged food, processed food, eating without appetite or not eating or not listening to your body calls is something, the biggest insult to your bodies you can do. Please stop doing that. And then if you are more interested, you can tune in for more Ayurveda knowledge.
So, doctor, one last question that you touched upon diet and food. If somebody wants to follow Ayurveda, is it important then to just be vegetarian, strict vegetarian? Because that's a common question that people have, because in West, or not just in West, like 1 out of every three people are either non-vegetarians or eggetarians or not strict vegetarians.
Yes,
so can
that's
they still
right.
follow Ayurveda?
Of course, yes, no doubt about it. So Ayurveda doesn't tell you to be vegetarian. It's your personal choice, decision at the end of the day. Yes, but Ayurveda also classifies meat, Shweta. We have different kinds of meat categories and we have to study about those meats as well. Like a meat of a chicken is different from a meat of a beef or a pork. Depending on the prakriti of a chicken and beef, the vibrations and energies of that animal will also be transferred into your system. Okay. So, it never says to stop eating, but depending on the illnesses, let's say you are having a very severe gut issues, then we would say, okay, give rest to your gut to, let's say, red meat for a while or a particular kind of meat which could be intolerant or which could be taking too long to digest. Vegetarian food doesn't take much time to digest and get out of the system. If you are already intoxicated, we would like your body to feel more easy, calm, and light. Right. In that scenario, we could say, okay, stop some of these foods for a while and then you can get back to it.
Until your body gets reset and you completely eliminate the toxins, right?
Yes.
Okay.
Rather, in certain diseases like tuberculosis, it is recommended to give meat soups and meat soup bastis.
Oh,
any
in
now of the
Ayurveda as
meat
well?
soups. Yes.
Oh.
Because because that's the time when the patient is going through dhatukshaya, or you call as is going very much weak in days, in very quickly he's going very weak.
That is given as a medicine.
Like
then.
a like
Yes,
a
it's
medicine, like a
yeah.
tonic.
Right.
So for a short period, and then it might be taken out. So it's not about being vegetarian or non-vegetarian.
Thank you. Thank you. Thank you so much for being on our show. I think
Thank
it was
you.
wonderful talking to you, and I
Thank
hope
you
our
so
audience
much.
enjoyed.
It was so nice having you
Yeah.
as well. Yeah.
So we will see you in the next episode. Stay tuned.